First things first, there are 19,224 confirmed aggregate cases of coronavirus across the state since, of course, the beginning of the pandemic. That's 90 new cases since our update yesterday. Sadly, there have been now 576 Victorians who have lost their life because of this global pandemic. That's an increase of 6 since yesterday's report. 3 of those deaths occurred prior to yesterday. Of course, our thoughts and best wishes, our prayers and sincere condolences are with those 6 families. This will be an incredibly difficult time for them, and we send our best wishes to each of them. Those 6 fatalities are made up of 5 males in their 80s and 1 male in their 90s. All of those deaths are linked to outbreaks in aged care facilities. There are 406 Victorians in hospital. 18 of those are receiving intensive care, and 13 of those 18 are on a ventilator. A total of 2,248,952 test results have been received since the beginning of the pandemic. That's 13,912 results since yesterday. Can I just pause there for a moment and again appeal to every single Victorian who has even the mildest of symptoms, please come forward and get tested. It's so important to our understanding of how much virus is there, its patterns, its chains of transmission, and it is critically important to us having as much certainty as is possible when it comes to making very important decisions about that roadmap to open up. So please, if you've got any symptoms whatsoever, come and visit one of the more than 190 test sites across the state. If your circumstances are such that you can't go and get tested, then we can come to you. The turnaround time is much faster now than it's perhaps ever been, with many tests, indeed the majority of test results back within 24 hours. It's a very simple message, but it's a very important one as well. If you have any symptoms whatsoever, as soon as those symptoms begin, please come and get tested. It is essential to us defeating this second wave. There are 4,351 cases of unknown source. That's an increase of 24 of those mystery cases that have been closed out by our coronavirus detectives since yesterday. There are 332 healthcare workers who are active cases, and we send our best wishes to them for a speedy recovery, and we acknowledge the amazing work that they're doing, their care and compassion and the skill that they bring to a very challenging task. There are some 2,415 active cases across the state. In terms of usual updates, the regional number, there are now 125 active cases in regional local government areas that are operating under stage 3. That number continues to fall and is very pleasing. We have always made a priority of trying to drive that number down as low as possible so that we can keep the case numbers and the virus experience in regional Victoria very different to what it is in metropolitan Melbourne. Both strategies are working, but it's very important to see those numbers continue to fall, and I'm deeply grateful to every regional Victorian who is coming forward and getting tested, following the rules, playing their part in driving those numbers down further. Greater Geelong, as you know, we have been quite concerned about Greater Geelong. There are now 40 active cases there. That's a decrease of 10 and no new cases. Greater Bendigo has 8 active cases and no change in terms of reduction and no new cases. And Ballarat has 5 active cases and similarly no change to those numbers. Those numbers will continue to fall as people work through the relevant period and are then cleared as a recovered case. Aged care outbreaks, there are 1,177 active cases, 97 active outbreaks of a total, looking back to 1 January, of 163 outbreaks. The disability facility settings, there are now 35 active cases in those settings, 23 cases amongst staff members, 12 cases amongst residents. So those numbers continue to stabilise and indeed fall, and that is good news given the underlying vulnerability of many of those residents, the underlying vulnerability of those settings in a broader sense. Now, the only other thing that I have to do today beyond, of course, take your questions, is to inform you that the Minister for Emergency Services and the Emergency Management Commissioner have provided me with advice in accordance with the Act to further extend the state of disaster until the 13th of September to essentially bring it in line with the state of emergency, which, as you know, the 4-week extension for that ends on the 13th. So 4 weeks ago, we indicated that stage 4 would need to run for at least 6 weeks. We only have the power to extend those state of disaster arrangements for 4 weeks, so there was always going to need to be an extension. We think having both of those frameworks on the same timetable is important and will serve us well when we get to announcements on the weekend about the roadmap, announcements on the weekend about what the weeks and months ahead look like. I just want to caution, though, that doesn't necessarily mean that either the state of emergency or the state of disaster will automatically come off on the 13th. So I don't want people to read into the alignment that those measures will all of a sudden expire on the 13th. Those decisions and that roadmap out, or indeed multiple roadmaps for regional Victoria as well as metropolitan Melbourne, must be and will be driven by the data, the number of cases, mystery cases versus those where we know the source, the volume of cases as well. All of those issues are the ones that will drive Brett's advice and the advice of his team and the decisions that the government takes. The state of emergency essentially are the rules and the formality that sits behind them, and then the state of disaster provides for the appropriate enforcement of those rules. So, for instance, under the state of disaster, if a party was going on at a house, then the powers for police to enter and to deal with those issues, they are derived from the state of disaster. So just to be clear, they are now aligned, they have been extended and they need to be renewed on the 13th of this month, and we'll have more to say about that on Sunday when we release the roadmap out of this second wave. I probably don't need to say much more at this stage. I might just ask Brett to speak to the epidemiology of the day, and then we're happy to take any and all questions you have.
Thank you, Premier. I'm not sure I have a great deal to add in terms of the epidemiology either. It is good to see 3 consecutive days in double figures. Wednesday's maintaining its reputation as a bit of a spike day, so an increase of cases since yesterday, but there has been more testing as well. Again, we want to see the cases that are out there, and people really should come forward for testing so that we can identify anyone who does have coronavirus and follow up their close contacts. But there's absolutely a stabilisation in numbers. We're seeing only 3 or 4 new cases in the whole of regional Victoria on a daily basis now. And that's why the active cases are coming down so significantly, because there are really very few new cases arising in those local government areas. The same in aged care. There's absolutely a stabilisation of the active outbreaks. There's still a number that haven't been closed off. It does take a period of time before we would declare an individual facility as having closed its outbreak. It does need to go through an entire incubation period of 14 days. But we're not seeing so many new cases in aged care. We're certainly not seeing new outbreaks in aged care, and so the number of active cases in aged care has been coming down by 100 or so each day. Similarly, in acute health settings, there's stabilisation in the number of active healthcare worker cases, and the number of new healthcare worker cases has dropped below 10. So I think 5 yesterday, 6 today, with some under investigation. And equally in disability services, not seeing new cases there. We're seeing active cases who are recovering, and therefore a gradual drop in the number of active cases, mostly amongst staff rather than residents in those settings. Overall, only a few new outbreaks each day, and the burden of our cases are really in 25 or so local government areas. So there is a concentration that remains in the north and west, but also in Casey in the southeast. There's diminished activity in a lot of local government areas, especially in regional Victoria, which is how we want it to be and how we want to keep it.
Can I just ask about, you weren't in favour really a few weeks ago of testing people who don't have symptoms. Have you given any thought to, in some way, a controlled testing of people who don't have symptoms to keep the test numbers up?
We have done that to a degree. So there are some high-risk settings, some high-risk industries where there's been more proactive testing of asymptomatic individuals. It remains very low yield. So you have to do thousands and thousands of tests to find a case. We should really focus our efforts on making sure that more than 50% of people who have symptoms who aren't getting tested are coming forward for testing. That's still got to be our priority, because some of those symptomatic individuals will have coronavirus. They're not showing up in our numbers because they're not coming forward for testing.
So how do you know that what's that 50%?
We are doing surveys, regular surveys of people who have coronavirus compatible symptoms, and we're asking them if they've gone and gotten tested. That's also part of national flu surveillance, where people are reporting online that they have compatible flu symptoms, which are really the same as coronavirus symptoms, and whether they've gotten a test for coronavirus. And for people who have more severe illness with fever, it's above 50% for people who are getting a test for coronavirus. But for people who have very mild symptoms, just that scratchy throat or runny nose or very slight cough, it's below 50%. So we know that we want 100% of people with compatible symptoms to be tested.
That's over time? That's not just one moment in time?
No, that's over time. That's a regular snapshot that's being done.
And hay fever. If you get hay fever, do you go and get a test? Because, I know what hay fever feels like. It's not a cold. Do I need a test?
Look, there'll be some people where it's an itchy nose for a short time in the morning, a couple of sneezes, I get something like that. Totally resolves after, minutes. And then there's no ongoing symptoms. There's no cough, there's no fever, there's no headache, there's no fatigue. That doesn't require testing. But for people who have ongoing symptoms, even if they might think it's their hay fever, if they're compatible symptoms with coronavirus, we would ask them to get tested, because if they're developing coronavirus, they will have those symptoms, and it'll be hard to tease out for the individual.
Professor Sutton, if I could just ask, our third day in double digits, but the number is obviously 20 higher than yesterday. When you saw that figure, were you happy with that kind of being in line with where your game plan is at the moment?
Oh, I guess it's in line with expectations. I'm never happy with a number that's higher than zero, but it is to be expected. We have had more people coming forward for testing. I do think that there are going to be 100 plus actual cases out there each day at the moment. We want to find all of them. So it is important that we increase those testing numbers, and we'll have days when we find more people. That's okay. But it is broadly in line with what modelling has suggested we'd be at this stage.
And I know you can't have a yardstick or predicting, and it's hard when we ask you what numbers we need each day, but if we're seeing it more, where is a number at the moment that would raise your concerns around whether we're going to be on track to do whatever the plan is that's happening on Sunday?
Certainly if the 7-day trend, the 5-day trend isn't decreasing over the next week, that would imply to me that we're not on track. But if it continues down, and it doesn't have to be huge drops, if it continues down, then we're heading in the right direction. We can certainly make those considerations that we're already talking through.
Given this testing, can you put on the number of active cases that we have in the community right now? Because I feel like we often look at the daily number and we hinge our hopes on that, but how much of opening up is dependent on those actual active cases, the ones we've seen from past days?
Yeah, active cases are not quite as much of a concern. They're obviously known cases. They're in isolation at home. They're admitted patients in hospital, or they're being looked after in aged care, so they're contained in that sense. But if there are, as there are currently, 2,500, there's always the potential that they're going to infect close family members if they're isolating at home, if they haven't taken up an offer to isolate elsewhere. So there is always that ongoing risk of transmission, having another generation of cases. So it is important that we see that continue to drop. But they are known factors, and they are controlled. We know where they are. They're being looked after to be isolated.
But do you worry about engaging with them as restrictions ease? Obviously, as restrictions ease, there's that temptation to go out with more freedom. How do you engage with those people and make sure they are isolating? Well,
certainly there's the daily check-in that's happening. That will continue for every active case, no matter how many we have. Operation Vestige, where people are getting the door knock and being checked on for their isolation or quarantine, is going to continue. And so I think we will absolutely continue to engage them. And I think for people who know that they've got coronavirus or who know that they're a close contact, even as we lift restrictions, they'll understand that their obligations are absolutely to be isolated or quarantined wherever they are, and we'll be checking on them.
Do you know what percentage of people are testing positive from the testing, even as these testing numbers are dropping, and how that's changed and if that's significant?
Overall, it's about 1%, but there are local government areas where it's closer to 2% or above 2%. So we know those hotspot areas are going to have higher percentages, the proportion who are testing positive. We focus our testing in those areas. It has come down over time in recent weeks as case numbers have dropped. But that's not universally the case. Casey, for example, has probably seen an increase in the proportion testing positive. And again, there's a push to get testing done there because I think not enough people are testing in the southeast compared to the northwest.
Do you support a national definition of a COVID-19 hotspot, and should that definition be used to determine who can travel to which state?
I think it would be great if we can get there. It's a really vexed issue, and in many respects it's not an issue that's front of mind for me in Victoria, because it's an issue for other states to define where there's areas of current transmission. So, if you're a jurisdiction with no active cases or only cases in hotel quarantine and no community transmission, then your issue is about how you define hotspots in other jurisdictions. So it would be great if we could get to that. I think it would, potentially make for an easier movement of people across the country. But it is, it's a pretty vexed issue. Every jurisdiction is going to come to its own threshold.
And is the difficulty in working out what that definition should be? And I guess what principles would you use in working out what the threshold should be?
It is difficult in some ways. What's the objective of naming a hotspot? If it's for trying to have some freedom of movement across the country, that's one thing. But if it's defining how you would apply a quarantine requirement for people coming from those hotspots, or indeed an absolute ban on people coming from those hotspots into your jurisdiction. And as I say, every jurisdiction will have its own risk threshold in that regard, and it's really for them to make the call on it and to try and come to a common view if they can.
Have there been discussions at AHPPC about that, and do you expect that to be on the agenda in coming meetings?
It has been discussed. It's going to National Cabinet as a point of discussion.
I wanted to pick up an earlier point that you made. You said asymptomatic testing of people in high-risk zones has yielded a low result. What does low actually mean?
1 out of thousands of tests being taken. So if someone's a close contact, we test them in outbreak settings. So in a meatworks, in an aged care facility, if there's a single case in a resident or a staff member, we're testing everyone regardless of symptoms. So they're higher yield, but that's a different circumstance, a different setting where we're doing close contact testing essentially. But for the general population, even in high risk settings, it's hundreds to thousands of tests that need to be done to pick up someone.
And where are we getting most of our positive cases, particularly over the last few weeks as case numbers have come down?
We're still seeing it in those areas of the usual suspects, Wyndham, Brimbank, Hume, local government areas. But, some smaller postcodes pop up within those local government areas with some clustering of cases. So that changes over time, but it's remained in the north and west. But as I say, Dandenong, Casey local government area has been more of a concern in recent days.
And is it mostly healthcare and aged care still?
Not universally, certainly healthcare to a degree with the Peninsula Hospital cases. Aged care, often in those postcode hotspots, it's because of the active cases in aged care, but there's also community cases that are often linked to workplaces and their households, their close contacts in households.
So can I just clarify that a large majority of our transmission is still in workplaces and then family transmissions?
It's still aged care, healthcare, workplaces, high-risk workplaces, other workplaces. and then close contacts of known cases.
And just the mystery, forgive me, I just can't.
Talk.
Mystery cases, do you have any sense, I know this is the hardest question because you have to investigate, but this week, out of those numbers, the 70s and the 90s, how many of them are mystery cases or community transmission?
We're still seeing around 15% as a proportion of our daily totals as mystery cases. For today's numbers, I can't tell you because they will be closed off in the next 48 hours probably. But looking back over the week, it's clear that it's still sitting at around 10 or 15%. So we're getting to single figures for mystery cases. We do want to get it down as low as possible, and we'd be very happy if we see none at all.
So what's the tolerable, because you said yesterday you'd like no mystery cases. Is liking mystery cases, liking to have none, is that the same as what we have to have before we ease things?
I don't know that it's going to be an absolute condition, but we do need to have very low numbers in order to lift in certain areas in certain ways, for sure.
And what's tolerable? Because I looked at New South Wales, I think they had something like 22 in the month of August, so almost one a day. So they can endure one mystery case a day, say. Is that a tolerable level, a level that we could open up?
I don't know that we've landed that yet. It does depend where they're occurring. If they're all clustered towards the end of the month, it's not about a daily average if you suddenly get a significant number that you can't track down in a short period of time.
And has,
On mystery
has
cases, when we entered stage 4 lockdown, there were 760 mystery cases. There's now 4,351. How is it in just over a month that we've seen so many mystery cases?
So they're the ones that have been closed off through the investigations of all of those historical cases. The proportion of our daily totals that have been mystery cases was early on, late June, at about 15%. It rose above 25%, it's come back down to 15%. So those 4,000 are of all of the cases that we've had right through, and a lot of them have been closed off in recent weeks, but they're not recent mystery cases.
So was it possible when we entered stage 4 there wasn't 760 mystery cases? It was actually over 1,000?
Yeah, we would have had more that hadn't been closed off in terms of the full investigation. They would have still been classified as under investigation until you can go through that very detailed step of understanding that they have no close contacts, they have no links to other cases.
Saying as there is 4,351 mystery cases, just how confident are you that we can get down to hardly any?
Oh, I think we can get there. If we can get cases below 30 and the proportion of mystery cases is, continues to be driven down, then we'll absolutely be in very low single figures, and we will do that more detailed investigation, upstream investigation that I've talked about, where you're actually looking at everyone they've been in contact with, not just when they're infectious, but in the 14 days before they became symptomatic. So that's acquisition testing. You're looking at all of the people they've been in close contact with where they might have gotten that infection from. So it's not just doing the history and the interview to try and find that out, but it's testing all of those people, including with blood tests, serology tests, not just the PCR swab at the back of the throat, to determine whether they might have been the original case. And if you can understand that, then you can explore their close contacts and where that chain of transmission might be occurring.
And so does that include asymptomatic testing in those cases as well? Is that where you see a role potentially in the future?
Yeah, for acquisition testing, for that upstream testing, where many people have likely recovered already and therefore won't have symptoms anymore, you might want to be doing the PCR testing to see if the virus is still around, or that serology testing where it shows that someone has been infected but is no longer infectious.
Professor Sutton, I'm just a bit confused with the numbers. So it's possible that we had far more than 760 mystery cases when it was announced on stage 4 lockdown. We're now getting different numbers with deaths every day. So this is the third day in a row that we're now seeing deaths reported that actually occurred some time ago outside this 24-hour period. Is that something we should just expect from now on, just more deaths I suppose, popping up that actually occurred some time ago?
Well, as
or
I've said in the last
mystery
couple of
cases?
days, there are reporting delays from some facilities. They've got new mandatory arrangements where they have to report to the Commonwealth. They're catching up in their reporting to DHHS, and so there will be some that come through in coming days. But I don't think anyone's too confused by the fact that we can say here are the deaths that have occurred in the last 24 hours, and there's another number that are historic deaths, but are otherwise not in today's numbers.
Why is it that it's only 3 days ago that we all of a sudden had to catch up with these reporting?
Well, that's when the reports have come in from those facilities. I can't speak to when they've collated them and when they've made a decision and gone through the process of reporting them. We obviously would love to hear them now and have that absolute confirmation with the Commonwealth's numbers.
I suppose I'm just, how confident can Victorians be that these are the right numbers, that this is our death toll and this is the accurate number of mystery cases, if it was possible that it was far more than what we were told a month ago?
Yeah, I don't know how to answer that really. These are the numbers that are reported to us every day. They're accurate with the information that we receive. The same with our mystery cases. They are not resolved on the day that we get the notification of a positive result. They're resolved in the days that we investigate them. So they'll be closed off at a different point in time.
I wanted to ask about modelling.
Sorry, Samaya.
Sorry, thank you. I just wanted to ask about modelling. Our case numbers are on track with what your modelling has suggested. What about the mystery cases? Is that 10 to 15%, I guess, yeah, is that on track with what modelling
You
suggests?
can't model mystery cases, so they'll be part of that total number within the modelling. But it'd be great to be able to separately model them, but they're not part of that. The ability to model for them.
We're hearing reports that in some regional centres, testing facilities are scaling back and even closing. Are you familiar with that, and is that sending the right message to regional communities?
I'm not familiar with it. I would hope that the accessibility of testing remains very broad across Victoria. We know that even if there are local government areas with no cases now, that was the case 6 weeks ago before we went into this wave in full. And we know that people need to be able to access testing to be able to find those cases. So even if there's no active cases in our local government area, it doesn't mean that it can't be seeded from Metro Melbourne, from another area where there are cases. So I'd hope that there's always access to a testing site. I can understand scaling back if they don't need the staff because the number of people coming forward for testing isn't as great, but I think the access needs to be there right through.
So even if there's no new cases or anything, they can scale back, that's fine, but they really need to remain open?
Yeah, I would absolutely advocate for the accessibility of testing sites across the state.
Further to that, the government's established 6 new COVID regional response units. Apparently the nearest one to Mildura is at Bendigo Health. From your point of view, should the North West have its own, notwithstanding the lack of active cases there at the moment?
I think it's working really well in terms of how the regional units are operating, and they're having those discussions with the rather vast areas in their regions. I haven't heard from them that they feel that there's a need to devolve again out to the far northwest. But if there is, I think it could be explored. But they've certainly worked very well in terms of understanding the local issues, addressing the cases very promptly within their regions, and having the established community relationships and organisational relationships that's helped them really respond very robustly for those regional cases.
Can I ask you about the curfew? Do you see an ongoing role for a curfew in any way? And is it possible, looking back, that you can tease out what role it has played?
It's a little bit difficult to know exactly what it's done. We know that clearly it's reduced mobility in those hours. I think it makes it easier from a compliance point of view to find people who are breaking curfew and are not travelling for legitimate reasons, and they're people who are unnecessarily putting others at risk. Obviously, if you're going to work, if you're going out for another essential reason, the curfew doesn't apply. You can move, but I think it's made it easier from a monitoring point of view for police to be able to find people who are breaking curfew, and they are potentially putting others at risk. So I think it's useful in that regard. As to how long it'll be needed for, they're still under consideration.
And can I ask it to establish why there's been an increase in cases in the Casey and South East area? Is it predominantly linked to the outbreak at Frankston Hospital? Or?
No, I think there's always been some transmission in the southeast. The numbers have picked up with aged care outbreaks, with the Peninsula Health outbreak, but there are also workplaces that continue to drive transmission in the southeast, and they're not dissimilar to the workplaces where we've seen high-risk cases previously. So I think that's part of it.
Can I just ask to clarify? Are you considering curfews of any sort into the future, or do you think that that's done?
Well, as we've said all along, everything's on the table. Nothing's off the table. It'll be a consideration to continue, but we'll look at what role it's played in fuller detail this week.
And just to follow up to yesterday, you said that you didn't know about a man who was on a plane to Brisbane and who apparently had tested positive. Have you found out any more information about that?
So there's nothing else to say in that regard. There was no infectious individual on a flight to Queensland.
Or anyone who had previously tested. That's not something that would obviously come to the attention of authorities then?
So we wouldn't name an individual as with all our notifiable diseases, but there's nothing to follow up in terms of Queensland needing to take action for close contacts or contacts on a flight.
Do you think that we'll all be wearing masks mandatory at Christmas time or in the next few months?
Yeah, look, Christmas time is a billion years away at the moment, but...
Do you see any end in sight in the next month or couple of months, or it's just...
I think we'll see masks for the next month in one form or another. As I've mentioned before, it may not be all settings at all times, but masks have made a difference. Masks continue to make a difference across the world, and there's increasing evidence of their use and their usefulness, and there's not much of a downside. I know that, some people... find them uncomfortable. It's an inconvenience, but in the grand picture, they are a small thing to introduce at a pretty low cost. I think there was a financial study in the US that suggested their true value is about $58 for what they prevent in terms of their healthcare costs of coronavirus in that jurisdiction. So it's a pretty useful intervention.
And can you just clarify in what way you think masks work? Because it seemed to me the science was it stops me giving someone the virus but doesn't stop me getting it. So what's making a mask work?
It's a bit of both. I think it's most useful for those who have coronavirus to be wearing a mask in terms of reducing that risk. And it's perhaps particularly useful because of the infectiousness in the day or two before you develop symptoms. And so for those individuals who won't be on guard, who won't be isolating necessarily, who'll be out and about for essential reasons, that they reduce the risk of transmission to others. But even for the recipient, even for the uninfected person, you've got less of a chance of breathing it in through your nose or mouth. It doesn't protect the eyes, so it's not a guarantee, but it is that additional level of protection.
Do you know if the mask and the curfew, does that change people's behaviour away from the curfew? Am I more cautious? Is the population more cautious because they're wearing a mask and they know they've got to be home by 8? It
is hard to tease out the direct and indirect benefits. I think there's already been evidence that wearing masks makes people distance from you more, so there's a double benefit there. And I think it was pretty clear that we were going through an enormously challenging time in our second wave, and making masks mandatory had that direct usefulness in reducing transmission, but it was absolutely a signal that everyone needed to do something here and that everyone needed to take this seriously, and that the risk of transmission was amongst all of us across the state. So I think it had that additional signal.
There's been recent research that suggests bandanas and scarves, for example, aren't as effective as surgical masks and these masks. Professor Brendan Crabb wrote about it in a newspaper yesterday about advising against the wearing of masks, scarves, bandanas and face shields. Do you have any comments to
I think we've always said that the recommended mask, cloth reusable mask, is a 3-ply mask, and we've given some instructions on how it can be made or the things to consider in wearing a mask, and that it's ideally better than a single-ply mask. ideally better than a face shield. It is better than a bandana or a scarf in that regard. When we made it mandatory, we were absolutely conscious of the fact that, you know, most people would need to have 3 or 4 masks at home with their families, and for themselves, you don't just use one, you might need 2 or 3. And so we didn't want to have a significant impost on people. But again, it's for consideration. We do understand that there are greater benefits with a 3-ply mask, and so I would still make that recommendation. Whether we move to saying, scarves or bandanas shouldn't be used at all, I think, you know, we'll keep that under consideration.
And a face shield's useless if you don't have a
No,
mask.
they're not useless. They give some protection, but again, you know, they sit here, they protect your eyes, but less so your mouth. And if you're not wearing a mask with a face shields are used in hospitals to protect the eyes and to give some additional protection, but they're always worn with masks. They're not worn on their own.
Are you still actively considering some options for single people, sort of any sort of bubble they might be able to pursue?
Yeah, we are. We recognise how hard it is. I know people have made the comparison to New Zealand and the policy settings that they had. They were in a different time, and it was less challenging in terms of the numbers that they were dealing with. We've had to do very, very strict things in Victoria to get on top of our much more substantial community transmission, but we recognise the enormous personal costs that some of this stuff brings.
Just got a question for the Premier, if I can. I'm being a bit cheeky here because I'm actually asking these on behalf of some kids at High Vale Secondary, but they're good questions anyway.
Sure.
Online learning's obviously been reasonably successful. Are you thinking about including some more online learning, remote learning, once things get back to normal?
You mean in terms of, say, the 21 academic year? As
Yeah.
a feature of...
As a feature, because there's obviously some parts of it people like and the
Yeah.
work.
Well, look, I think that what we'll have to do, and what schools are doing already, is looking at all the different experiences. There's been obviously a lot of things that have been very frustrating and challenging and difficult, but there are also some things out of this pandemic that we might well try and hold on to. So I've made the point a few times that, for instance, the notion of spending, not every worker and not every day, but for some workers spending some time working from home is no longer a concept. It's something that's been done for 6 months now. And the sense I get is that for where it works best, there'll be a number of people who'll try and continue those arrangements in one form or another. And that'll be something that employers, including the public sector, will need to be alive to. Similarly, I'm sure that schools that's the nature of schools. They're always looking for improvement. They're always looking to do things better. I'm sure they will have received lots of feedback about things that are tough and hard and not things you want to end, as well as some positive feedback about things that could be a feature of next year.
And they want to know if there's a date for them going back to school, and if they go back to school, might the schools get shut down again if there's another? They
are exactly the same as the 3 school students in my household. They would very much like, one of whom is doing year 12. They would very much like to have a definitive date about when things will go back to normal or when things will go back to, you know, a different set of arrangements. Sadly, I can't provide that level of certainty. But what I can say to those students and every student, every teacher, every staff member and every parent, we're all working as hard as we can to do this in a safe and steady way, so that, for instance, we can get our most senior students through, but then have all students in 2021 have an academic year, an educational year that is as close to normal as it can possibly be. And you only get that if you ease out of these restrictions with a steadiness and a real focus on safety, so you can then lock in a COVID normal that doesn't run for weeks, but can potentially, this is our hope, can run for months and months and months.
But they have to keep in mind, don't they, that, I mean, you might have to shut schools down again. Obviously, you don't want to, but it's always
Raph,
possible.
on an individual basis, individual schools rather than the whole system, there won't be a change to the way we manage outbreaks. If there's a positive case at a school, then the same approach that's applied: deep clean, close the school, everybody goes home, then they come back once it's safe to do so. I can't see that changing.
One of the things child psychologists have raised is for yourself to hold a press conference for kids with kids, follow New Zealand leader Jacinda Ardern's footsteps. Is this something that you would potentially consider?
We're always looking at different ways in which we can engage. Always. And as we speak, there are I think, 9 different breakout groups that are having detailed consultations with various ministers about opening up, about the roadmap. I do lots of different meetings, not all of which we make a big deal of. Sometimes it's a very private discussion. I had a number of discussions with nurses and others in the health sector, and it's been really useful. At least that's the feedback. It's been useful for my purposes, and I think the feedback from them has also been that they have thought it a useful use of our time. Yeah, we're always open to looking at different ways to engage.
Including with kids, being
Yeah, sure.
grilled by them?
Sure.
Yeah.
I've had some engagement with very small children, and I'm more than happy to look at different ways that we can give people the opportunity to get the facts that they need and to have their opinion heard.
On interstate travel from Melbourne to Sydney, Gladys Berejiklian was asked about it yesterday. She said that she'd bring into 2 factors. One would be the case levels in Victoria, but also Victoria's contact tracing system and the amount that they can turn around and tell people that they might be infected or there might be close contacts. Is that a concern for you, that if she's talking about Victoria's contact tracing system as something that might be holding Victorians back from...
I haven't seen her comments. I have many discussions with Gladys. She's not raised those concerns with me. But we will continue to work together. That's really important, together with South Australia. Tassie will be another one of these issues. Of course, Victorians want to travel around the country, and the rest of the country wants to come here. There are many good reasons to do that. There are many very important reasons to do that. That's why my discussions on Monday night with the PM were about let's do the most meaningful thing that we can do to get the borders open, and that's stay the course and drive these numbers down to the lowest possible level so that we can lock in settings and not be bouncing in and out of rules and restrictions, losing control at periodic points. That we don't want to do that. That's why you only got really one chance to get this roadmap right, and it has to be driven by data. And I think once that's done successfully, then many of the concerns that are driving, and again I'm not being critical, many of the concerns that are driving other states to close borders simply won't be a relevant factor.
But the data's relevant, isn't it? The Premier's not alone in wanting to know more about the performance metric of contact tracing.
No, let's be very clear. New South Wales report the same information to the dashboard that we do, and we report the same information that they do. So there's no more or less...
A lot of senior epidemiologists and people who run health institutes don't agree. They think you're less transparent than other states.
Well, in terms of what the New South Wales government and other state governments feel it is appropriate and actually contribute, they contribute the same data that we do. So if I suppose the real test of whether you thought you were being more transparent than others would be that you would volunteer additional information over and above the national dashboard. That might be happening. I don't believe it is. I stand to be corrected on that. But again, all of us, and this is the key point, all of us, regardless of which state we are the First Minister of, we are all focused on getting case numbers down as low as possible, and then in a cooperative way, working together. I've got nothing but respect for Gladys Berejiklian. I work very closely with her. I have done for months and months, years in fact, and I don't see that changing anytime soon.
How do you allay the fears of those premiers and also business and industry groups who want absolute confidence that the contact tracing system is up to scratch and has improved since May?
Well, I just make the point, my first responsibility is to get these case numbers down within Victoria. The free movement of people from Victoria to Queensland and vice versa is not the number one priority. It's important, but it's not the number one priority. Whether you can go to Queensland or not, that's a second order issue, frankly. We are about driving down case numbers here. And as you see, these numbers would not be falling the way they're falling if some of the commentary and critique of contact tracing were in any way accurate. I'm not for a moment saying that we don't every day strive to make that system better. We do. We absolutely do. And you can see, whether it's in IT, using artificial intelligence, machine learning, all the way through to putting more staff on, all the way through to some pretty old-fashioned stuff, like going and door-knocking people who we can't find. All in every way, every single day, we are looking to make that the best possible system that it can be. And the fact that we've been able to achieve improvements, very significant improvements, whilst we've had the highest volumes that any state or any contact tracing team in the country has had to deal with, I think should be seen as a positive. I certainly see it that way.
Can you, the artificial intelligence that you've spoken about, can you go into a bit more depth around that?
I can't, but I'll be happy to find someone who can. We just use the best of tech, whether it's in relation to modelling or trying to have code that's written that can be as predictive as possible, that can interpret particularly long-form interviews, try and find patterns that might not necessarily be obvious. All of that's it's kind of cutting-edge technology, but it's used in lots of different places, and it's just a logical and sensible thing to do.
And how much financial investment have you made, particularly over the last 2 months, to improve the contact tracing system?
I'd have to come back to you in terms of the numbers. I would say that it's not often that you would. It's not often that I've said to senior officials and others, what it costs is not really the issue here. I don't often say those words, but the impact of this not working is so big that you've got to employ the best technology, the right number of people, because ultimately the reward on the other side for that albeit significant investment is so much bigger.
And if there's any chance we can get all of these, very quickly, if that's possible, notwithstanding the fact that you don't care whether people can travel to Queensland.
No, I didn't say that I didn't care about it. What I said was, and I think Victorians would back me in this, my job is to get numbers down here in our state first, because that is ultimately the best and most important thing we can do to get the borders open. Satisfying other premiers, the only thing that will satisfy them, and I'd be exactly the same if the situation was reversed, is to drive these numbers down as low as possible and then have a safe and steady roadmap out, and then have a series of settings that are consistent, and that sense of control as best you possibly can, something that's as widely as infectious as this.
So just on the slow, safe and steady moving out of stage 4.
Well, certainly safe and steady. We hope it's not slow as such, but it'll need to be steady. It needs to be absolutely steady. If we were to open up, as some are urging that we should open up right now, and if we did, well, it'll be a couple of weeks of movement, and then these case numbers will explode. Hospitals will be overrun, and not just for COVID patients. I've made this point many times. There are a lot of people who need hospital care every day, and they just wouldn't be able to get it for non-COVID related issues. There just wouldn't be a bed. There wouldn't be an ICU bed. There wouldn't be a theatre that could do whatever they needed done. This is the experience of so many other countries around the world. The other point too, and we should never lose sight of this, and it's not about frightening people, it's just the facts. This is not something you want to get, because whilst some people will recover quickly, there's growing evidence that this presents more like a chronic condition than a cold that you'd shake in a week. So no one wants this, because you can be otherwise healthy, you could be quite young, and there can be long-lasting effects of this.
Just to finish my point.
You wanted to know whether you get all the answers to the things I've referred quickly. I absolutely will do as fast as we can.
As we get out of these restrictions,
Yep.
I think Victorians and also businesses just want the confidence that the system has been improved, and they'd like to.
I think that they are right to be confident about that.
Just think.
And they're also right to be absolutely in no doubt that every single day, and I spend many hours every week in very lengthy meetings talking about all the different ways that we have improved and can continue to improve, that culture won't change. We'll be every single day trying to find the minutes, the hours that make a real difference. And arguably, they're not wrong in what they're saying. That is to say, they're not wrong to be concerned that we are always looking for improvement, because arguably when the task is so focused, because you've got such low numbers and the risk is so great that it spreads quickly, you need to be ready. I think we are, but we just got to get the case numbers down to a level that gives our contact tracing team and our coronavirus detectives a fair and decent chance. No contact tracing team in the world would be able to go from 90 cases a day, where 15% of those are mystery cases, with a couple of thousand, 2,500 active cases, no contact tracing team in the world could ever be big enough to open up and kind of pretend that you would be able to keep a lid on that. It'll just explode. And the feedback I get is, yes, people want this to be over. We all do. But at the same time, they want the pain, the hard work, the suffering, the massive contribution that they've made these last few months. They want it to mean something. And it'll mean nothing if we don't open steady and safe and then have stability for months and months to come.
We've had official...
If the testing numbers don't improve in the next few days, well, could that possibly change what you say
I don't
on
want to get
Sunday
into, Mary, I don't want to get into putting sort of ultimatums out there. All I'd just say, and I've said it, I don't know how many thousands of times I've said it now, and look, people, I'm still deeply grateful to think that we've got thousands of people every day, and the best part of, what are we at now? We are in the order of, we're heading to 2.3 million probably in the next few days. We'll get to 2.3 million tests. And the vast, vast majority of those have been people that have come forward with symptoms. There's been some asymptomatic testing, but it is the vast, vast majority of those people who've come forward with symptoms. And it's just a matter of us continuing to remind, continuing to ask Victorians. It's a massive contribution that you can make to driving down numbers, to keeping your family and other families safe, and to opening up. It's absolutely critical that we have the most complete picture. So at this stage, we're going to just keep every day and in every way, using every single platform, we're going to continue to ask Victorians who've got even the mildest of symptoms to come forward as soon as they get those symptoms. And the lab turnaround times now, it's roughly 1 day. Some people, many results are back before then. It's a very important thing.
So notwithstanding that you're encouraging people,
Yep.
it's not, you don't think it's going to derail what you're going to see on Sunday? in
I
terms
don't
of-
think so, but at the same time, what I'd say is that people need to continue to come forward and get tested. And if you want, I'll put it to you this way, if you want, once that steady, safe, easing process is finished and we've found that COVID normal, if we want that to be enduring, if we want that to be our 2021, then people with symptoms continuing to come forward, a high percentage of those, continuing to come forward and get tested as soon as they experience those symptoms and then staying home while their tests are processed, that's going to be an enduring feature. It's going to be an enduring feature, and I am now and I will be then proud and deeply grateful that so many people are coming forward and doing that.
We've had official confirmation in the last half hour or so that Australia is now in the worst economic position it's been in since World War II. Do you regret the role that Victoria's second waves played in that position that we now find ourselves in?
Well, this is an unprecedented event. This is a 1 in 100 year event, and there is a massive job of repair and rebuilding to be done. I think that Victorian workers, Victorian businesses, the Victorian government and all of its partners are equal to that task, and we will make announcements in due course about an absolutely unprecedented program of investment to save jobs, to create new jobs, and to work with business, to work with communities, individuals, to repair the damage that this wicked enemy has done. We are all challenged by the impacts of this. It is very, very concerning, but at the same time, I think that the focus needs to be on repair, on rebuilding, and on the recovery that I think we will be able to achieve. But I suppose, Rachel, the point I'd make to you is those national accounts won't get any better unless and until the health problem is dealt with. And whilst we might wish it to be a different way, logic, science, international experience simply tells you that unless you get these cases down to a very low level and then you can ease out of these restrictions and lock in a COVID normal that allows people to go back to work, businesses to reopen, profitability to return, economic growth to be a feature of 2021, then we won't achieve any of those things. They are captive in many respects to the infectiousness of this virus and the number of people who've got it. That's what logic tells me.
And how confident are you, given that we were on a good path when we came out of the first wave? Obviously, hotel quarantine intervened. How confident are you that we won't see a third wave?
Well, as confident as you can be. There's no certainties in this, other than I think this one. If you were to open up too much too fast, then there will be a third wave. That very act of not properly defeating the second wave will be the starter's pistol on the third wave. There's just no question about that. And we'll have a few weeks where everyone is quite understandably up and working back, assuming that these settings can be locked in for the medium term and the long term, but that won't be real. The only thing that you can be certain of is that the only way to find a dependable, reliable and something you can defend, something that you can defend against this virus, a COVID normal that runs for a long time, is to safely and steadily ease out of this second wave after having defeated it.
You've said you've accepted responsibility because you're the Premier on hotel quarantine.
On many times I have made that point because it's true.
Sure. So does that mean you accept that ultimately some of the recession the country's going through lands on your desk? Is some of that responsibility with you?
I'm acutely aware, acutely conscious, and I'm ultimately accountable for not just the way the virus is presented, the challenges we faced, some of the mistakes that have been made, but I'm also absolutely responsible and accountable for the recovery plan that we put in place also. And there's a lot of work going into that, and that will be an historic and an unprecedented level of investment, because that's what's needed right now, whether it be to drive economic activity or to pay down the borrowings that we've simply had to go into. There'll be no paying down debt until the economy starts growing again. That's just the fact. That's what the Governor of the Reserve Bank tells us. That's what Stephen Kennedy, the head of the Treasury, tells us. It's what the Prime Minister announced after the last National Cabinet meeting. We've all got to do more, and we will. But at the moment, if I can kind of order all the different responsibilities and all the different accountabilities that I have, the thing that I'm most acutely focused on at the moment is getting this roadmap right and just continuing to make the point that unless it's done safe and steady, it's just not going to work, and there'll be no economic recovery until it does. So we have to do this right, and I'm confident we can, because I think that my sense is that the vast majority of Victorians, they want their pain and their sacrifice and their hard work to count for something. They don't want it to be out of control again in just a few weeks or a few months' time. That's why we're all focused on trying to prevent that, doing everything we can to stop that from happening.
The Federal Treasurer has criticised you in recent days for overseeing one of the biggest public policy failures in the state government's history. Considering the economic position that Victoria has been in for a number of months now, are you disappointed that the federal government went ahead with cutting JobKeeper and JobSeeker rates?
Oh, look, I'm not here to run a commentary on the federal government. I had a lengthy conversation with the Prime Minister on Monday night that was focused on things that we can do together and that we need to do together, and he didn't raise those criticisms. He didn't make those points to me. Ultimately, this time, this unprecedented event requires all of us, Prime Ministers and Premiers, and indeed beyond, to put aside our political stripes, to put aside the political party that we're from, and work to get this job done. That's what I've always done. That's what I always will do. I just don't have time, nor would I think Victorians wouldn't want me to be involved in that, and that's exactly why I'm not.
One of the criticisms he made was that extending the state of emergency for either 6 months or 12 months sends a wrong signal to businesses. Do you think, cutting JobKeeper and JobSeeker sends an even worse message to those businesses who are currently struggling?
Samaya, with the greatest of respect, I don't turn up here every day to be communicating with the federal government. If I need to speak to the federal government, I pick up the phone and I speak to the PM, and that happens regularly. And that's part of a productive, professional relationship. That's how I think professionals work, and that's the way that I'll be continuing to operate.
Chanel. Tony Abbott has made comments, I don't know if you've seen them, but he said that the extension of the state of emergency is, to use his words, the way of running a health dictatorship. What do you make of those comments?
I could only refer you to the answer I've just given.
another historic day. We've lost the grand final. Just can we go back as to how this all came about? Did the Victorian government effectively try to sort of fight to keep it, to get any circumstances where they could stage it, or was that just, did the government say actually we're ruling it out from the get-go?
I think there's been a whole range of discussions between us and the AFL. I'll leave them to make announcements about those matters. But, you know, I think that you've got to be a realist about the circumstances we face. And it takes time. You need weeks to lead into an event as big as that, and it's not fair to say, well, we've got a contract and we want it honoured. We're not prepared to have a discussion about alternative arrangements, even though we know we can't provide the AFL with the lead in time that they need. So, you know, part of working in good faith is that all parties have to understand the things that you can't change. And we are in a situation now where we all need to be focused on getting these numbers down, but also operating to make sure that on the other side of this, we've got every chance at hosting big, significant, major events, and I'm really confident we'll be able to do that. But October the 23rd, I think, is too early for us to be, if you like, pretending that we could do that. We've got a big challenge, and we need to be focused on that. And it's been a very positive discussion with the AFL.
So the government didn't try to somehow make it work, to have some sort of vision of the grand final that could potentially work?
Well, I think that the notion of having a grand final with no crowds, when there are alternatives, you know, I don't think that would be fair. So we are accepting, as challenging as it is, we're accepting of the fact that our circumstances on October the 23rd are unlikely to be able to, or 24th it is, I think. Anyway, end of October, I think it is unlikely, very unlikely, that today, in fact it's impossible, that we can give the AFL some of the certainty they need so many weeks in advance.
Could you even have reduced crowds?
Oh, well, again, I'll let the AFL make the announcements that they're going to make. What we're really keen on is, and what we're focused on, is dealing with the challenge we face, and you have to be a realist in that. And the notion that we could have a kind of business as usual or anything like a business as usual grand final this year, it's sad, but it's the truth, and you have to be upfront about that.
Once the cases come down and we're over this second wave officially, will you be looking at reopening the hotel quarantine program for return travellers?
That's entirely a matter that will be determined. I'll speak with the Prime Minister about return travellers and arrangements for them. As you know, that program has been reset under the direction and command of Corrections Victoria, with police input where it's appropriate, but it's too early for us to definitively answer that question.
Premier, a really quick question on the contaminated soil. The EPA making approval yesterday that it can be dumped back at Smarsh.
Yep.
Does the state government think that Bacchus Marsh is an appropriate place to dump it?
Well, the EPA have made some decisions. I've got no announcements to make about those, but the EPA at arm's length, a proper independent process, a statutory authority, have made some findings. They have determined these matters, and I think you'd accept. I'd hope you'd accept that my focus is very much on pandemic-related matters at the moment. But if there's anything that Minister Allen can add to that, then I'm sure that she will.
On pandemic-related matters, the state of emergency extension bill passed Parliament last night. What deal did the government strike with the Greens to get Samantha Ratnam?
Yeah, look, I've seen some of this commentary. We have on this bill, like we do on every bill, we have a good faith discussion with the crossbench. Sometimes members of the crossbench will vote with us, sometimes they won't. It's about finding common ground. I think there's been some compromise. We've given some ground. 6 months is obviously less than we sought, but it's a very important step forward. That process is not concluded yet. It's got to go to the lower house tomorrow. And again, I'll just make the point, these are not rules to keep the place shut. It's a framework that allows us, and the certainty we need, to open up safely and steadily. We have good faith discussions with the crossbench, and sometimes we're able to find common ground, sometimes we aren't. I'm very pleased that, at least from the Legislative Council point of view, we've been able to do that last night.
Other than the 6-month concession and the increased transparency of tabling the Chose report every 4 weeks, were there any other promises made to the Greens in order to have Samantha Ratnam return to Parliament and vote?
Oh, well, Ms Ratnam returning to Parliament is entirely a matter for her. You should speak to her about.
Well, I'm asking you, with due respect, what other promises the government made to the Greens?
Well, we have, as I said, we have good faith discussions to find common ground. That's what we do, and we have been able to find common ground. And I wouldn't, again, equally with the greatest of respect, I'm not criticising the way you phrased it, but I wouldn't skate over the fact that it's half the period of time, and there are some additional transparency measures. I think that's a really important outcome, and one that we're happy to deliver on. Of course, we've still got some. I don't want to get ahead of ourselves. We've still got another process to go through, and we'll deal with that tomorrow. And that'll give us the legal certainty that we need to open up. But on every bill, on every single bill, we speak to all the crossbench. Some vote with us, some don't. That's part of having a respectful, good faith process, and that's the same on this bill, and it'll be the same on every bill for the rest of this cycle.
What are your thoughts on the report into the Police Informer Royal Commission, the report that was tabled?
I wouldn't, whilst I might want to give you a detailed commentary on that, I don't think it would be appropriate for me to do that. This is an ongoing process. It's a Royal Commission that was called by our government literally moments after we were re-elected, when all these matters, it was pretty clear that we needed to do that. It's one of the very first briefings, I think the first incoming government briefing that I had after the election in 2018. We've established a Royal Commission. They're doing their important work, and a time will come when we can speak in freer and more fulsome terms, but I just don't think it's appropriate to do that now.
Can I just ask a question? I know you don't like being a commentator, but I'm going to try.
You can certainly try. I always like it when you say, can I ask a question? Of course, I'm certain you will.
We'll see how we go.
I'm absolutely certain you will.
This press conference clearly enables you to speak more directly, more often, to more Victorians than you ever have before.
I've been told that there are many people who tune in.
Yeah.
And many
So
tune in.
I think it sidelines...
every day, which is
I
good.
think this sidelines us, the mainstream media. Do you think this press conference makes the mainstream media less relevant to your political fortunes because you've got more direct communication?
I value my hour and a half most days with the mainstream media,
I'm sure you do.
all of whom are sitting in front of me. Not all of you are visible to the camera. Maybe the audience would prefer it otherwise, but I wouldn't agree with that analysis at all, Raph. And the fact
make
that,
the bad headline less relevant?
well, I'm not
Because you're
motivated
talking more
by
directly.
bad headlines or good ones. Seriously, just have a look at the politics in this state, look at the history of this state in the last 6 years. Do you really think I'm motivated by bad headlines? Really?
That wasn't my
Like,
question
I get
about
on
your
and
motivations.
get my job done,
Yeah.
and I'll leave it to others to judge whether that's to their liking or not. My focus has always been on getting on and getting the job done, and that's what I'm absolutely committed to, and it's why I stand here every day to take questions from the media and to answer them until you have no more to ask. I am not concerned about those things. I never have been. And if I were, and if I might be so bold as to say, if they were the start and the finish of how things worked in Victoria, then perhaps I wouldn't be standing here. Because there's not been that many good ones, has there? You've got a job to do, go and do your job. I respect the work you do. You'd have to give me some credit, I would think, that at every point in my life, in my public life, I've advocated for more voices in the media, not less. I've been absolutely steadfast about that. You've got a very important job to do, and that's why we try and be as respectful and as hard-working in terms of following up issues that you want as we possibly can be.
And does this make it easier to get over the bad things that are said about you?
Well, but I'm not saying that.
No, I'm not saying
What
you
I'm
are.
saying to you,
just asking
what
you.
I'm saying to you is that I'm not concerned by that. People are perfectly free to have views, they write columns, tweet, post, whatever. That's what a democratic society is about. But I've neither the time nor the interest in being fixated on those things. I know there are some people in my business that over a long period of time that do spend a lot of time worried about those things. I'm just not one of them. I'm far more focused on fighting this virus in the first instance, defeating this second wave, and then getting back to what we do best, and that is creating jobs, leading our nation in terms of economic growth, and getting things done, building things, setting us up for the future. That's a massive task. It's a massive task, but one that I think Victorians are equal to.
Premier, you've been there was a letter written to you, I'm sure many people write to you, but by
Yes.
50 doctors talking about the stages 4 and 3 really having large mental impacts on people.
Yeah, and
on more people than the virus itself. Your reaction?
Well, with the greatest of respect to those medical professionals, and I know many of those doctors, I've met and worked with many of those doctors in my time in public life, and whilst they're entitled to their view, I respectfully do not concur with their view. We have got a significant number of Victorians who have died whilst we've had these rules on. So I don't think you can predict that if you were to open up too much too quickly, that death rate, as challenging and as tragic as it is, would hold. It simply wouldn't. The number of people who die from this virus would only go up and up. And what's more, and again, I don't want to in any way be disrespectful to those medical professionals. As I said, I know many of them, and I've got nothing but the highest regard for the work that they do. But the chances of any of their patients getting the care that they need when our hospitals are overrun, logic just tells you that's not going to be happening. We've got to get past this, and then we can have elective surgery come back on. We can have hope we can deal with the big challenge where some people who ought to have gone and had cancer screening perhaps haven't had that. Well, there's going to be a catch-up job to be done there. We're going to have to do that, and that's been talked about at National Cabinet. Something I'm very focused on. I would respectfully not agree with those comments, but I honour the work that they do. And again, a multitude of opinions is not a bad thing, but I just don't see that as a way forward. The only way forward is to safely and steadily open up after we've defeated this second wave properly, and then lock in a COVID normal where the provision of healthcare will be much easier, and we can return to something approaching normal levels. I would just take this opportunity to say, though, there are no rules that would prevent anyone from getting the healthcare that they need. It is safe to go and visit your GP. It is safe to go and get the primary care or other care that you need. We know that there are many surgeries that have not been able to happen, and that's principally about safety and creating capacity in the health system for those who needed to come out of aged care. That won't last forever, and again, it'll last only for so long as it needs to, and it'll be much quicker back to something approaching normal the sooner we properly defeat this second wave.
I just wanted to ask really quickly, you mentioned tech before and opening back up.
Yep.
Are you looking at smarter ways to use technology, say, for example, when people go back onto public transport, to look at CCTV cameras that pinpoint if there's a large cluster of people on a platform, things like that, and alerts come out and say, hey, take the next train, it's too busy. Departments investing in this new technology to make it easier?
That's a good example. I can't confirm whether we're doing that. The exact example you've given me, I'm happy to come back to you, but I know that departments and agencies are looking at how can we use all the tools available to us. So it's some really old-fashioned stuff. So it's visible presence out there, speaking to people one-on-one, all the door knocking we're doing at the moment, all the way through to using artificial intelligence, supercomputing and other things of that nature. So there will be a mix, and I think that anything that can be deployed against this enemy will be.
When we got out of stage 3 restrictions, arguably Victoria was much slower, safer and steadier compared to the rest of the country. There's obviously an argument to go even slower and steadier this time round just to make sure we can defeat the virus. Will Victoria get out of stage 4 much slower than we had gotten out of stage 3?
I don't think you can compare the two. I think that the first wave and the second wave are two very different things in the way in which change of transmission, the amount of mystery cases, the amount of workplaces that were a feature of the second wave, I should say still are a feature of the second wave. I think it's difficult to compare the two. That's why much more a traffic light system, that's what's going to guide us, and we will try and have maximum economic benefit in those phases, but done safely. There's no good pretending that somehow the fact that X thousand workers are back on Y day, when it's not safe and won't last, is the preferred outcome. It isn't. So when I say safe and steady, that's exactly what it has to be. Otherwise, it won't be lasting. It'll be, if it's quick, it won't be safe, and it won't last very long. And I don't think anyone in Victoria, this is the feeling I get, this is the feedback I get, I don't think anyone in Victoria who's given so much wants that frittered away and to count for nothing. They want that to enable a long-term COVID normal. Now, I can't guarantee that, but I can certainly, all of us can make that more likely by a safe and steady roadmap out of this, and that's what we'll speak to in some detail on Sunday.
Can I ask Professor Sutter
Certainly.
a question? One of the things that we did after getting out of stage 3 was increase, for example, the number of visitors you can have in your home from 5 to 20 virtually overnight. Do you think that contributed to the quick transmission of coronavirus inside the community?
I think in retrospect, there was household transmission that was absolutely driving some transmission in the early stages of our second wave. We didn't know what was ahead of us at that time. We have always been cautious and we've been steady in many respects. This virus finds its way, and you can just be unlucky in some regards as to where it finds that gap or pathway through. And we can't have regrets about what's happened. We absolutely have to learn from everything that's occurred and to make sure that we're addressing every single one of those gaps to the fullest extent that we can.
And what have we learned from easing out of stage 3 and then out of stage 2?
I could write a book on what we've learned coming out of this stage and coming out of the first wave. I think it's exactly that. It's that the virus will find a way, if there is any vulnerability, if there is any missed area that hasn't been considered about how it could transmit and how it could take off. And so you have to think of every single unreached community member. You have to think of every single weakness in workplaces, every single infrastructural, operational process element in all of those settings where transmission can occur more readily. I think that's what we've gone through. It'll be an ongoing battle, but so very many lessons.
And how confident are you? I know it's probably going to be impossible to think about 100% of things, but how confident are you that we've been able to think about 99.9% of little details?
Yeah, look, I think people around the world are still getting surprised by this. I don't know that we'll get to 99.9%, but it's not through lack of looking, and it's not through lack of trying. But we, we'll get it through that respectful engagement with people with contrary views, with fresh ideas and new approaches, and I'm open to that.
Are you going to write a book?
Are you a ghostwriter?
I would just say, that's entirely a matter for Professor Sutton. I would just say that there are no jurisdictions around the world that really have come out of a second wave, and have been able to hold it. So it's, this is really important work for us to get this right, and that's why we're determined. And back to that central point, all the feedback I get, and no one's enjoying this. No one's pleased to be in the reality that we have to confront. But people don't want everything they've given to count for nothing. They want it to mean something, and they want it to be translatable into long-term, stable settings until we get the vaccine that we need. Can I just finish where I started, perhaps if there's no other matters? Please come forward and get tested. Any symptoms whatsoever. And as soon as they begin, please come forward and get tested. It is a massive thing, simple, but a massive thing that you can do to get us open sooner as well as to protect your health and the health of others. If there's no other matters, thank you. I'll see you tomorrow.
Thank you.
Victoria has recorded its third day of double-digit case numbers, 90 new infections in the past 24 hours. Sadly, 6 more families have lost a loved one to coronavirus, and it comes as the controversial bill to extend state of emergency powers has been passed during a marathon late-night sitting. Christina Hearn has the story.
Well, the contentious bill finally made it through the upper house just before 2 o'clock this morning. The final vote 20-19. There certainly has been a lot of heat in this debate. Independent Catherine Cumming making her feelings known about the bill pretty clear with some hand gestures on her way into Parliament. But in the end, Greens MP Samantha Ratnam secured the crucial vote for the Andrews government, returning early from maternity leave. The government, of course, faced a fair bit of backlash over its initial plan for a 12-month extension of the state of emergency. In the end, it was a compromise deal of 6 months, with 3 crossbenchers rallying around that. The Australian Industry Group, however, is still not happy.
What that means for business is we have 6 more months of uncertainty. We just don't know when the Victorian government will use those powers or how they'll use them.
The state of emergency, of course, does give the Chief Health Officer ongoing powers to impose COVID restrictions.
AFL history is being rewritten due to coronavirus. Queensland will now host the game's 2020 grand final. Let's go live to Reece D'Alessandro. Reece, a history-making decision for the AFL and the Sunshine State.
Yeah, most certainly is, Davina, and it's all but a done deal as we go to air this morning. We're expecting an official announcement early this afternoon, but we understand come October 24, the 2020 AFL Grand Final will be played under lights here at the Gabba. We know 400 AFL officials and their families have left Melbourne. They've been flown into the Sunshine State to join the AFL's Gold Coast hub. This move widely considered to be a reward for Queensland for essentially and effectively saving the AFL 2020 season. Brisbane Lions star Simon Black has told the Today Show it's not just that, it's also a massive coup for Queensland footy fans. Take a listen.
What's happened this year with the state being able to save the season, I think it only makes sense to be able to hold the real showpiece of the year up here in Queensland, and it's only going to help grow the game further. So it's going to be enormous, and we're all going to get around it. The next few weeks, the build-up is going to be quite incredible, and we're going to make it. We know Victoria put on a good event, but we'll make sure Queensland do as well.
This has raised a few eyebrows with regard to COVID-19, though. Obviously, over the last couple of weeks, Queensland has had some issues relating to medical exemptions at the Queensland-New South Wales border. Massive confusion for people trying to get into Queensland for medical care. At the same time, you've got hundreds of players, officials and their families coming into Queensland seemingly effortlessly to be part of the AFL's Gold Coast hub. This is a political tightrope the Queensland Premier has had to walk, and one she addressed in a press conference in Cairns this morning.
Given there is a significant community spread in southeast Queensland, do you propose to pack the Gabba?
Sorry, what's the significant spread?
Significant spread of coronavirus
But there isn't.
in southeast Queensland.
But there isn't. It's
There has
contained.
been.
No, there is not. That's not correct.
Do you propose to pack the Gabba at capacity?
No, that's not correct. I reject the premise of your question.
Yeah, those border issues aside, Davina, one thing is all but certain this morning. For the first time in the game's 123-year history, the AFL Grand Final won't be played on the hallowed turf of the MCG. Instead, it'll be at the other G, the Gabba, here in Brisbane.
OK, Reece, thank you. Well, there are 2 new cases of coronavirus in Queensland after more than 18,000 tests were conducted throughout the state in the last 24 hours.
They are linked with existing known cases, so we're very comfortable with that. That takes our active cases to 28.
Meanwhile, Queensland Health has revealed former bikie Shane Bowden did not have coronavirus when he flew from Melbourne to Brisbane on Monday. Authorities earlier said he was infectious on the flight, sparking alarm for dozens of passengers on board. A Western Sydney school is closed today after a student tested positive, with tracing teams linking the new infection to a nearby outbreak. Girraween Public School is being deep cleaned as the cluster at St Paul's Catholic College grows by 6 more cases. It comes as New South Wales Premier Gladys Berejiklian revealed plans to open up the state and economy going forward.
What I want all of us to think about in the future is what can we do in New South Wales as opposed to what we can't do. Now, that goes for major events, it goes for milestone events in people's lives, whether it's students, whether it's organisations and whether it's families, whether it's religious occasions.
There have been 17 new infections recorded in the past 24 hours, 8 of them linked to the CBD cluster. And it comes amid growing tensions over the Queensland border. We'll have the Premier's reaction coming up very shortly. Well, 2 of Victoria's former top cops are under fire after a key report on the Lawyer X Royal Commission found Tony Mockbell's conviction was tainted. Isabella Shafskovsky has more.
Drug kingpin Tony Mockbell has received a major boost in his bid for freedom as revelations this morning suggest the Lawyer X scandal could have catastrophic consequences for our justice system. 124 convictions, including those against Mr Mockbell, have been tainted, while more than 1,000 criminal cases could have been affected by the actions of Nicola Gobbo. But the allegations of corruption go right to the top. 2 former Chief Commissioners, Simon Overland and Graham Ashton, are now in the firing line. Claims against them suggest Simon Overland knew what was going on and Graham Ashton thought the ends justified the means. Whether or not any criminal charges will be laid will now be up to the Director of Public Prosecutions, but we do know that the names of individual police members involved will not be released. The reason behind this is there is fear it could impact future trials. A full report by Royal Commissioner Margaret McMurdo will be handed down in November, but Victoria Police has already released a public apology to the courts and the community. The statement in part reading, "It was an indefensible interference in the lawyer-client relationship. Our failure at that time to ensure these circumstances were identified and disclosed was also a significant and missed opportunity to right a wrong." It's now a waiting game to see how those convictions will be affected and whether this apology is enough to instill public confidence.
Never one to be told what to do, President Trump has ignored pleas not to step foot in Kenosha, Wisconsin, amid the violent unrest over the shooting of black man Jacob Blake. With pro-police policies firming as the linchpin of his re-election campaign, Trump tried to soothe the broken city as the Blake family drowned out the president's promises with an event of their own. Amelia Adams has more.
President Trump took his law and order campaign to the city of Kenosha today, touring the damage from last week's violent riots. He met with business owners, he pledged millions of dollars to help the community rebuild and to support law enforcement. He met with and thanked local police, praising their actions in getting the violence under control. And he said he doesn't believe that systematic racism is an issue in American policing.
We have to condemn the dangerous anti-police rhetoric. It's getting more and more. It's very unfair.